Well, studio, we welcome to the program now Andrea Sanders, Commissioner of the Mississippi Department of Child Protection Services. Thanks for coming in, Andrea. Appreciate it.
Thank you, Gerard. It's good to be back.
So I know you have lots of information to update us on with respect to child protection services. Why don't we start out by just explaining exactly what CPS does?
Well, that is a great place to start. We do a lot of things for a lot of people. Our mission is really simple, though. We're here to protect children. And one of the best ways to do that is to strengthen families in Mississippi, whether it be adoptive, foster, or biological families. We stand in the shoes of parents for today around 3,900 kids. And we also work with another 4,000 kids and families that have not yet been taken into custody, trying to help prevent removal of the children, keeping them safely in their own homes. But as you can imagine, it's that's something that's it's not a simple matter.
Yeah. So how do you get involved? How do you get engaged and involved with children in these challenging circumstances? What brings in CPS?
We run a 24-hour hotline, and our statute in Mississippi is pretty broad. Most everybody's really considered a mandatory reporter. Generally, we get tips and calls all hours of the night. Mississippi has an anonymous reporting allowance in our statute, so we actually get a whole lot of calls. We get about 34,000 in the past year. And so it's a little bit tricky to wade through those and triage and ensure that we're really spending our limited resources on the right calls.
Well, that's another question that comes to mind is how are you looking with respect to resources? How many folks are employed by CPS?
We have around 1,750 right now. We've had we struggle with turnover in the same way that every child welfare agency across the country does. We've actually made some progress over the last 2 years in bringing our turnover rate down. Nationally, the average is somewhere around 30%. It was around 35% when I first came into the agency, and we have brought it down as low as 21%. So, the key to keeping a stable workforce so that we can meet the needs of children adequately is to both reduce turnover and also hire enough. And we've made a lot of progress there. The agency traditionally, in 2017, we were at a low of 45% of our workers had what's considered a manageable caseload, a reasonable caseload. Today, we're sitting at 70%. So that's a high water mark for the state. And, it sounds like a lot of numbers and data, but it really means having enough people where the children are.
Yeah. Well, I think I've shared with you that my wife and I served as foster parents for a couple of teenage boys. This was in the 2008 time period that had suddenly lost their only parent, their mom, and were going to get swept up into the system. There were no foster parents available to take care of two teenage boys in the state. And my understanding is when that occurs, then they, I guess, are transferred into the federal system, and then the federal government was going to essentially split them up, is what we were told, and we didn't want to see that happening. But where I'm going with this is working closely with our caseworker, who would not share and disclose any confidential information, but talk kind of generally about their caseload. That caseworker, as I recall back then, was responsible for 75 children, which was just, I couldn't comprehend it, honestly.
And you know what? We don't do a good job when we're overloaded like that.
Sure.
Our constituents in our work is live children, and they're children who've already been damaged in some way. And so they can't just be, it's not a stack of papers you can leave on your desk at the end of the day. And we actually don't have buildings and placements. I think sometimes the public gets confused that if you don't know what else to do with a child, just put them in CPS custody.
Yeah.
It's not a great place for kids to live. And so, the teenagers that you took in, that is the hardest age. It's hard to find placements, and it's also a difficult age for every teenager. You've raised your own. I have two, 13, 14. They struggle even with the best of environments. So
Sure.
giving them the opportunity to stay with their siblings and also stay in the community that they're already accustomed to. Your gift to those boys was you allowed them to stay in the school district they already knew, and particularly to stay together. So it makes a big difference when families step up and help meet those needs.
Well, these caseworkers, they're not highly compensated. And as I understand it, they're often on call 7 days a week, 24 hours a day. They get called at any time, day or night. And when that happens, they have to act. They have to go. And sometimes, as you know, it's to go into a home and take a child into custody, remove the child from that difficult situation. And just her sharing some of those stories with me and having to go to court, as you know, and you hear those stories when you go to court from the chancellor there that has to make some of these very difficult decisions. Man, it'll break your heart.
It's a lot. The staff that deal with children and families in our agency, we really run, like you said, a 24/7 first responder agency. Right now we do it on an 8 to 5 business model, and we've made a lot of progress, as I've mentioned, over the last 3 years in really getting staffing where it's reasonable or getting closer to being adequate. However, it doesn't take into account the fact that when the call comes, we have to go. And if we get 24 calls in one night in one county, we still have to go. So it's unique work. Like I said, it can't be put on a desk and left until tomorrow or sometime next month.
Yeah. So, and even though I know you strive to achieve a certain ratio of caseworkers to children they're taking care of, every case is different. So one could consume the amount of cycles of a caseworker that 30 others do.
That is absolutely correct. We are really seeing a trend lately. And honestly, it's typical of what every state is seeing across the country, and we're having more teenagers come into state custody because nobody knows what to do with them. They're high-end, high-need kids, and they have complex mental health issues, behavioral issues, and the country, honestly, and including Mississippi, is just really not ready for this mental health crisis that we're starting to see.
Yeah.
So the default is that they come into state custody, and I'm happy to take responsibility for them, but it doesn't really create a placement or treatment that doesn't otherwise exist in Mississippi.
Tell us about this new care portal. There's a recent press release on that.
That's really exciting, an initiative that I'm really excited about. It's an opportunity to bring faith-based and nonprofit and service-oriented organizations in Mississippi together through technology to start actually meeting the needs of families and children in ways that may shorten their stay in custody or safely keep them from coming into custody. The way it works is Care Portal is a company that built out a sophisticated technology solution that takes needs and meets them with a response with, it's like taking all the churches in Mississippi and pulling together exactly what they do best.
Sure.
So if we need
just aggregating the resources, giving them sort of one place to go to I guess, match up the needs with the providers that can help address those needs.
Yes, we already have 14 churches committed here in the Tri-County area, And, the example that I saw happen in Oklahoma was a grandmother needed a wheelchair ramp to keep a child who was in a wheelchair. And one church gave the supplies, one church sent a crew.
Wow.
So it's pretty amazing to watch it work.
Hang on, we'll get to some of the other accomplishments that your organization has achieved. On the other side of the break, we've got Andrea Sanders, Commissioner of Mississippi Child Protection Services, coming right back. Need to be in the Rock and Roll Hall of Fame, of course, REO Speedwagon. I'm still sore that they're not. We're going to get them in there, though. We're speaking with Andrea Sanders, the Commissioner of Mississippi Child Protection Services. So you handed me a sheet, which is very impressive, Andrea, that shows a lot of the accomplishments of the organization since 2021. You talked about workforce stabilization and really reducing turnover is a big thing. And we talked about the care portal. That just sounds like a great idea. I got to ask you, though, what took so long to get something like that? Was that a technology matter or just a function of just putting all the pieces in place to commission something like this? Just makes too much sense.
When we started with the agency, I think I told you originally there was a lot of foundational work that needed to happen.
Yeah.
Honestly, until you start getting the workforce somewhat stabilized, it's harder to do these things that I call getting fancy. Basically laying a foundation.
Sure.
And we've really gotten to a place where this kind of work is more possible. And I think that it really demonstrates the importance in state government, and especially in this kind of agency, of building on something consistently.
Okay.
Not that you can keep the same leadership, but if you set a course and start to really build on it, it takes a number of years to start to create really positive change in government.
Well, it's one of those things you look at, and I read how it works here. It's as they say, a no-brainer, right?
Mm-hmm.
I mean, it just makes too much sense, and so I'm pleased to see that. And it does certainly. It's prudent, is it not, to call on the faith community and even the private sector to help out with this problem.
Not only that, they are so willing and ready to serve in Mississippi. And, additionally, it reduces dependence on state government and shifts it to places that really want and need to help. And then the other thing it does is, because of the nature of our work, if a kid has needs, let's say they need breeches that fit.
Yeah.
It's important that they not go to school the next day after they've been pulled out of their home in clothes that don't fit. And that's just a small example. But with the state purchasing process, it's shockingly hard to get breeches overnight.
Yeah,
so
I get it. Lots of red tape.
This is an immediate response that doesn't have to go through the red tape.
Makes total sense. So you've also got a technology project going on right now, right? You've got a legacy system that you're in the process of modernizing, scheduled to go live later on this year, the end of September. So are you still using the old mainframe system that they've been using for so long?
We are. We had to do some work to it simultaneously to this other project because it had been on a platform that was unsupported for several years.
Yeah.
So there was a big risk of it crashing. We've gotten it to where it will limp along until we can convert over. But this project, the legislature was so generous to the agency in recognizing that, our technology keeps a child's story. And it's really important because if you have one caseworker that deals with that child and then leaves, somebody else has to pick up right then and there. So it's like, leaving a note for the babysitter.
Sure.
It really matters.
Yep.
And it really matters that we need to be able to generate data in a much more simple and consistent way. But that was a big lift to replace a technology system, a legacy system in Mississippi. And I'm really proud of our team. They pulled together, and we're not there yet, but we're on the home stretch.
Good. It's important. I have no doubt that will serve the caseworkers. I mean, that's really the people whose function you want to improve and enhance more than any, honestly. They're
Absolutely.
the ones delivering that service directly to your customers, essentially. So how do you get money? Where does your money come from? What's the funding model?
So, the state gives us a general fund appropriation, and they've been very they've been very responsive when I go to them with data and show them what the needs are. So we've increased what we bring in from the state incrementally over the last 3 years. But the really important other part of that we've been able to accomplish is that we've taken that money and we've multiplied it with federal matching dollars, and we've been able to increase what the state is bringing in from the feds up to about $20 million over in the last year. So that allows us to, I call it reducing dependence on state general fund.
Okay.
We're not exactly funded where we need to be right now, but there's a lot. We still have some room to grow the money we bring down in federal dollars.
So what about just the volume, Andrea? I mean, are you increasing caseload, decreasing, about the same? How's that going?
Gerard, that part scares me a little bit. We're coming off a pandemic. We know we have a mental health crisis going on, and we know that, we're a year and a half into the post-obs world, and we have taken a lot of measures as an agency to reduce safely the number of children in custody and to bring in robust in-home family services for children and families. But we're seeing a spike. Over the last 5 months, we've seen an unusual spike in the number of kids coming into custody. So the highest since I've been there, the highest number of kids in custody was around 3,950 when I first got to the agency. We have predictable dips and spikes that stay pretty similar over the course of each year that we've been able to track. But we've seen a steady uptick in the last 5 months. And so we're back up to 3,901 as of February 1st. So that concerns me a little bit.
Mississippi, as you know, we have a, if not the highest, very close to number of out-of-wedlock births. 57%, last I checked, of births in Mississippi are covered by Medicaid, highest in the country. Is this a factor that ultimately causes these downstream problems for children when their children are born out of wedlock, they're born into impoverished setting?
Absolutely. Poverty and, single parenting really contribute to just a difficult situation for families to thrive in. And, even if a family has enough financial means, single parenting is hard.
Sure. So,
yeah, absolutely.
So how do we reverse this? I didn't mean to interrupt you, but I talk about this a lot on the program. And statistically, it's just a fact. Children born into single-parent homes, it's not necessarily etched in stone that their outcome is not going to be as positive as it could be. But statistically, the probability is considerably higher. How do we reverse this trend, which has plagued the state of Mississippi for decades?
I think, excuse me, I think that first of all, investing in bringing higher paying jobs to families that bring insurance with them, that bring a number of factors that help a nuclear family stay together. We have a lot of fathers that we interact with who really want to be part of their children's lives. So it's important that we, as a state, really stay family focused and encourage and continue to support families in staying together rather than staying apart.
Yeah. I mean, it's no secret that the probability or the chances of a child thriving and achieving their greatest potential occurs when they are raised in that sort of environment where they've got a father in the home, a mentor in the home as well. I mean, that's just statistical fact.
Yeah, and that's one reason part of getting fancy this next year is we're going to be working with other agencies to start some fatherhood initiatives and really incentivize and encourage fathers to be a part of their children's lives.
Okay. Sure would like to see really folks from across the spectrum in Mississippi pay more attention to this. Not just our legislature, not just your agency and organization, but the private sector, our faith communities as well, other leaders that folks look up to.
Absolutely.
So that we could appreciate the value of just the traditional nuclear family.
Yes.
The odds are much greater that we're going to have positive outcomes. Appreciate you coming on, Andrea. Thanks for the work you do and all the good folks at Child Protection Services. Thank you.
Thank you, Gerard. I appreciate your interest in our work.
You bet. We're coming right back, folks, with half an hour of middays in the Element Wealth Studio.